Medicaid is a government-sponsored healthcare program that provides healthcare coverage to low-income individuals and families, as well as people with disabilities, pregnant women, and the elderly. It is jointly funded by the federal and state governments, with each state administering its own program within federal guidelines. Medicaid is the largest source of health insurance coverage in the United States, providing healthcare coverage to over 70 million people. In this video, we'll explore the history of Medicaid, how it works, who is eligible, the benefits and drawbacks of the program, and how it has evolved over time. Medicaid was established in 1965 as part of the Social Security amendments under President Lyndon B. Johnson's Great Society initiative. The program was created to provide healthcare coverage to low-income families and individuals who were not covered by private insurance or Medicare. The program was initially designed to provide healthcare coverage to people receiving cash assistance from the government, such as those receiving aid to families with dependent children, (AFC). Over time, Medicaid has expanded to cover additional groups, including people with disabilities, pregnant women, and the elderly. The program has also been expanded to cover a wider range of healthcare services, including preventive care, prescription drugs, and long-term care. How Medicaid works. Medicaid is a joint federal and state program, with each state administering its own program within federal guidelines. The federal government sets minimum eligibility requirements and provides funding to the states to help cover the cost of healthcare services. States can choose to expand Medicaid coverage beyond the federal minimum requirements, but they are required to contribute a certain amount of funding to the program. To qualify for Medicaid, individuals must meet certain income and asset requirements. In most states, eligibility is based on income that is at or below 138% of the federal poverty level. Certain groups, such as children and pregnant women, may have higher income thresholds. Medicaid also has asset limits, which vary by state. In general, individuals must have limited assets to qualify for Medicaid. Once enrolled in Medicaid, individuals can receive a wide range of healthcare services, including doctor visits, hospital care, prescription drugs, and long-term care. The specific services covered vary by state, and some services may require prior authorization or referral from a primary care physician. Medicaid provides healthcare coverage to millions of low-income individuals and families who may not have access to healthcare otherwise. Some of the benefits of Medicaid include affordable healthcare. Medicaid provides healthcare coverage to people who may not be able to afford it otherwise. Comprehensive coverage. Medicaid covers a wide range of healthcare services, including preventive care, doctor visits, hospital care, prescription drugs, and long-term care. Patient protections. Medicaid includes patient protections, such as limits on out-of-pocket costs and coverage for pre-existing conditions. Economic benefits. Medicaid can help support local economies by providing funding for healthcare services and supporting healthcare jobs. While Medicaid provides important healthcare coverage to millions of people, there are also some potential drawbacks to the program, including limited provider networks. Some Medicaid programs have limited provider networks, which can make it difficult for beneficiaries to find doctors or specialists who accept Medicaid. Administrative burden. Medicaid enrollment and renewal processes can be complex, which can create an administrative burden for beneficiaries and healthcare providers. Funding uncertainty. Medicaid funding is subject to political and economic pressures, which can lead to uncertainty about the program's future. Stigma. There can be a stigma associated with receiving Medicaid, which can make it difficult for beneficiaries to access healthcare services or feel comfortable discussing their healthcare needs. Medicaid is a government-sponsored healthcare program that provides important healthcare coverage to millions of low-income individuals and families, as well as people with disabilities, pregnant women, and the elderly. The program has evolved over time to cover a wider range of healthcare services and to include additional groups of people. While Medicaid provides important benefits to its beneficiaries, there are also potential drawbacks to the program, including limited provider networks, administrative burden, funding uncertainty, and stigma. Despite these challenges, Medicaid remains an important safety net program that provides healthcare coverage to vulnerable populations. As healthcare costs continue to rise and access to healthcare remains a critical issue in the United States, it is important to ensure that programs like Medicaid are adequately funded and supported. By providing healthcare coverage to low-income individuals and families, Medicaid helps to promote health and well-being for all Americans, regardless of their income or social status.